All right, good afternoon. I'd like to call the meeting to order. Thank you, thank you, thank you. I guess that stretch really did the job. I hope all of you are now in great physical shape throughout the day. So it's my great pleasure to welcome you to the 2018 President's Forum, which, as you know, is a special session at the end of our annual meeting when I invite major health leaders to join me in a dynamic discussion on a critical issue in health, medicine policy. Since it began 3 years ago, we've tackled important issues of aging and also healthcare reform. And if you remember last year's forum, we in fact tackled the opioid crisis, from which we say we need a more unified collective effort to look at evidence-based solutions. And as you heard from me today, we founded or formed the Opioid Collaborative, co-chaired by Admiral Brett Dzau, the Assistant Secretary, who's here. And it's been just great. Now this year, we undertake a critical issue that is so important in the U.S. and elsewhere, how to make life-saving and life-enhancing drugs both more affordable and accessible to all people, while continue to accelerate scientific innovation discovery and that's what's needed for breakthrough and cures. Now, throughout the day, we talked about cancer, and this last session was just outstanding, really already touching on the issue of cancer therapy, the breakthroughs, and the affordability of some of the CAR T and others. So as we talk about more broadly today, certainly we're thinking about prescription drugs, which, as you know, the annual expenditure is exceeding $500 billion, accounting for more than 17% of U.S. healthcare spending, and expect to rise. This is a major public interest and desire for action. A 2017 survey ranked making drugs affordable the top most priority for congressional action. So, as been said, what's access? Access is meaningless without affordability, and this is why I believe this administration is taking this on in a very, very serious and energetic and effective way. The President and his administration agree, and upon assuming his role as HHS Secretary earlier this year, Secretary Azar laid out 4 priorities for HHS: the opioid crisis, insurance reform, value-based care, and drug pricing. On the issue of drug pricing, President and Secretary were swift to take action. This past May, President Trump and Secretary Azar released the American Patient's First Blueprint, a comprehensive plan to bring down prescription drug prices and out-of-pocket costs. So we're really honored and delighted to have Secretary Azar with us today to discuss the elements of Blueprint and the administration achievement to date and the plans going forward. I believe he has some very important message for us and possibly a new policy statement as well. So we're certainly looking forward to it. So it is my great privilege to introduce Secretary Azar, who was sworn in as the Secretary of HHS in January 2018. All of us know HHS is the largest cabinet department in the federal government by spending a budget of $1.2 trillion in 2018. Secretary Azar has spent his career working in senior healthcare leadership roles both in public and private sectors. His current tenure at HHS is his second tour of duty at the department. He served as HHS General Counsel from 2001 to 2005, and then as Deputy Secretary, the department's #2 official and Chief Operating Officer. During his time as Deputy Secretary, Azar played key roles in international affairs, global health diplomacy, implementation of a new Medicare prescription drug program, public health emergency preparedness and response efforts, and food and drug regulation. He also led the department through several successful management and operational transformations. Secretary Azar joined the private sector in 2007, moving to Indiana with his wife and 2 children. And of course, it's a great pleasure to have him back at the helm. And it's a great pleasure to introduce you, Secretary Azar, as the 24th U.S. Secretary of Health and Human Services. Secretary Azar.